providers here at Pūr Skin Clinic, and today we're going to be talking about IPL, which stands for Intense Pulse Light. That treatment is good for sunspots and reds that you might have picked up during summer or summers past. This patient today has some concerns about some sunspots on his nose and some rosacea on his cheeks, so we'll take a closer look at those concerns now. So this patient's concerns are some sunspots that he's acquired on his nose, as well as some reds on his cheeks that are due to his rosacea, as well as some of the sunspots on his forehead. So we're going to be treating all of that today. In male patients, we aren't going to treat the bearded area because it can actually decrease the amount of hair follicles in the area treated. So in men, if that's a concern, we would just do from this area up. And then on women, we obviously can treat the full face. We're done with one pass over his face, and you can see, if you get close, you can see some of this pigment on his nose darkened up quite a bit. We are going to do a second pass over those areas, which it will get a little darker. And over the next couple days, he will notice that some of that pigment gets dark, almost like a coffee ground consistency, and it will flake off on its own. So we don't want anybody to scrub it off, but it will just naturally come off with the exfoliation process. So this little device I'm going to put on the end of this, and this is just going to give a more isolated output of the laser, and that's going to be able to go over just those little pesky spots that might not have been picked up as much with the first pass of the laser. So this is just going to make it a little bit more isolated. So I'll show you here kind of how I do it on some of his tougher spots. Cool down, just for comfort, and also because I don't want the skin getting too hot. I put a face ice mask on for about 10 minutes, and that feels really good for the patients, but also it helps kind of cool down the skin so it doesn't get too warm. So the post-care instructions that we're going to have him do is the skin regenerating nectar. I'm going to put this on him right now, but this is going to help increase his healing time. But it's also just going to help with the skin irritation, which is really great, feels really good post-treatment. And then obviously sunscreen. We love our Elta MD products, so we'll have him put that on before he leaves, but also do that every day, a couple times a day for the next 2 weeks. The biggest contraindication for this treatment is sun exposure, both pre-treatment and post-treatment. We're going to ask that you just be super, super careful out in the sun, wearing a hat and applying sunscreen multiple times over the next 2 weeks. We also ask that you don't have any sun exposure 2 weeks prior to this treatment because it can be very detrimental to us performing this treatment, so it will be a contraindication. We'll go over all of that stuff in your consult with you, but that's just kind of a quick basic overview of the pre and post care. This is after he sat with the ice on his face for about 5 minutes. You guys can see the redness has gone down quite a bit, but some of these spots that was previously mentioned did darken up a little bit, and that will continue over the next 2 weeks. Be gentle with your cleansers and washing your face. We don't want to try to aggravate or get those spots to come off quicker, so no harsh exfoliation, just regular gentle cleansing. They will come off on their own. But I'm going to apply some sunscreen. He's going to wear a hat, and we're going to send him on his way. He can receive another treatment in 4 to 6 weeks if some of these pigment, he wants to pick it up even further. What we usually tell people is about a 15% improvement each time that you do this treatment. So a series of 3 is our most common package. We can talk about that in the consultation process and find what's right for you.